Welcome to Individual Supports. During this training, you will learn what an individual support plan is, your role in developing the individual support plan, as well as a little bit about what a qualified developmental disabilities professional does here at BSDC. The qualified developmental disabilities professional here at BSDC goes by a couple different names. Some call us the QDDP, or sometimes just the Q for short. The role of the QDDP is to ensure all ICFDD regulations are followed, assures the individual's quality of life is supported, and coordinates all aspects of the individual's life. Some examples of that include leading and documenting IDT meetings, reviewing rights and restrictions, and obtaining Human Legal Rights Committee approval for any restrictions that we may need to implement. Reviewing assessments, monitoring for active treatment, developing and implementing individual support plans, auditing that those plans are being implemented as written, writing habilitation programs, and reviewing data and performance of objectives for those habilitation programs. Communicating with guardians, reviewing incidents and identifying issues or trends, and providing adaptive equipment or assistive devices to the individuals. And everything else that you may not see that involves each and every individual at each home. An ICFDD, or Intermediate Care Facility for the Developmentally Disabled, is not considered a permanent home. It is a step towards living in a less restrictive environment. From the time an individual comes to live at BSDC, the IDT begins discussions on how to assist the person to transition to a less restrictive environment. Part of this least restrictive environment is supporting our individuals to participate in activities away from BSDC to develop the individual's circle of friends. Off-campus employment or volunteer activities support this goal. An introduction to the interdisciplinary team, or the IDT. What is the purpose of the IDT? It's to review and identify the hopes, dreams, needs, and strengths of the individual, to develop the Individualized Support Plan, or ISP, monitoring the progress that the individual makes towards the plan, and any recommendations developed by the IDT. So what is your role in the IDT? Staff provide input to the team on firsthand knowledge of how the individual is performing and their current status. Staff collaborate and work closely with the QDDP to complete assessments such as the ILSA, or Independent Living Skills Assessment, which assesses the individual's ability to complete their activities of daily living. Completing the Personal Focus Worksheet, which really focuses on the individual and their preferences, as well as any relationships that they have with their friends and family outside of BSDC. Staff also work on identifying programming needs and ideas to help our individuals live as independently as possible. What is the interdisciplinary team? It's a team of members who possess the knowledge, skills, and expertise necessary to accurately identify the individual's needs and design a plan which is responsive to those needs. As you can see, the individual is the most important part of the interdisciplinary team and is supported by the Q, the guardians, the staff, and all the clinicians here at BSDC. An individualized support plan is also known as the ISP. The ISP assists in helping the individual increase their independence. It should be based on the individual's goals and desires for what they want to happen in their life. It should also take into account the person's age and any medical conditions that they may have. IDT meetings. There are a couple different types of IDT meetings. We have an annual meeting to develop the ISP for the next year. We have quarterly meetings to review the individual's progress and celebrations towards meeting the yearly plan. We have special meetings to review any specific aspects of the ISP or any issues that may have come up. Some examples of a special meeting include treatment plan changes, behavioral crisis, trends, or significant incidents. Site clinic meetings is which is a meeting where the psychiatric prescriber reviews medications annually or as needed, and that prescriber may make changes to medications as clinically indicated. Transition meetings are when someone is coming into services or leaving services at BSDC, and this may be a meeting planning on how to make transitions to the community successful. Your role as a member of the IDT, your input is valuable to help develop the ISP or make changes based on your firsthand observations of the individual. Changes are communicated a couple of different ways when we make changes to those ISPs. We communicate with T logs for things such as POS training changes for specific POS or dining cards, nursing care plan changes or medication changes, staff trainings, which include changes to a safety plan or mental health plan or a behavior support plan. There are some other general changes that may be communicated by the QDDP or even other clinicians, such as schedule changes. In the meeting minutes, you'll find plan changes that are documented on an agenda for a quarterly or a special meeting. And each meeting is summarized at the bottom of the ISP with dates and actions to be taken. This also includes the site clinic changes. Programming. The QDDPs work to develop habilitation programs for the individuals to assist them in living as independently as possible. We use a prompting continuum to decipher how independently an individual can complete some of their activities of daily living. This prompting continuum goes from the least assistance to the most assistance, independent being the least assistance and total assistance being the most assistance. Independently would indicate that an individual can initiate and complete a task without any staff intervention. They would just know that it's 8 o'clock, it's time to go take a shower, and they would do that all on their own. Cues and reminders are just that. The individual may need a cue. It's 8 o'clock. What do we usually do at 8 o'clock in order to initiate that task? Prompts can be verbal, gestural, or physical throughout the task. Verbal prompts are any spoken words used by staff to provide direction, such as, hey, it's time to go take a shower. A gestural prompt is any hand gestures to include pointing or signaling, such as pointing to a clock, indicating that it is 8 o'clock and that it is time to go take a shower for an individual. Physical prompts would include any physical contact between staff and individuals. That may be a brief touch to an individual or necessary guidance, such as assisting an individual into the bathroom to indicate that it is time to take a shower. Physical assistance would indicate that some hands-on assistance is needed throughout the task, such as hand over hand for starting the shower or washing their body. Total assistance is just that. It's hands-on assistance needed throughout the entire task. Not applicable would be if the task doesn't apply to that individual, and refused is if the individual is refusing to complete that task. The individuals have a daily documentation book, also known as the DDB. The DDB is for staff to have easy access to the information to provide safety, habilitation, and support to the individuals. This book will accompany the individuals everywhere they go. The individual's initials are on the outside of the book, and the most current documents are kept in the DDB at all times. The documents include the individual's active treatment schedule, their BSP or behavior support guidelines if it's applicable to them, their individualized support plan, again, or safety plan, again, if it's applicable to them, a mental health behavioral crisis intervention plan, if they have one, the point of service reference sheet, which gives you an idea of their positioning, how they take their medication, any treatments, any oral care, if they have a communication device, if they have seizures, their dining card, their nursing care plan, and any other ancillary documentation, such as their personal focus worksheet. When in the community, the DDB may remain in the vehicle for staff to have access if needed. And information for the nursing care plan and behavior support plan will be provided to the QDDP by those clinicians. Staff training. In Therap, you'll discover that there is a staff training program that will have documents for a safety plan or a mental health crisis intervention plan, a behavior support plan. Those documents would all be found in that staff training program. After completing the test that's associated with this, you'll need to get into contact with your home manager to schedule time to meet with your home's QDDP or more than one if your home is supported by more than one QDDP. That QDDP will then go over with you an individual's schedule, their safety plans, and any programming that they have.